What if you had an outlet for stress, overwhelm early in your career as a physician, pharmacist, or nurse? What value would that allow you to have? Would that allow you to maybe have a safe space to release your frustrations, have some camaraderie, be validated in a system that can be toxic with training at any level and in any discipline, not just for physicians in medical school? What value would that add to your life? Welcome to another episode of The Worthy Physician. I'm your host, Dr. Sapna Shah-Haque, combating physician burnout through awareness and reigniting your passion for medicine. Today, we have just that. Dr. Jean-Baptiste, or Dr. JB, also known as the Metaverse Doc, who has created a space out of her own experiences through her medical career for those early on, because medicine is hard. No matter what discipline you're in, medicine is hard. Dr. JB brings her own story, loss, trials and tribulations as working as a full-time ER physician, as well as creating her company, and I really want you to stay tuned and listen to this physician's pearls of wisdom and story and resources. So, Dr. Jean-Baptiste, thank you so much.
Thank you so much for having me. I'm super excited to be here.
Well, thank you. And I'm very fascinated about your platform of the Metaverse Doc. I've seen that on LinkedIn, and I think it's quite fascinating. So what drew you to that?
It kind of goes back to the beginning and why I created Hope for Med, my company, in the first place. And I guess it kind of goes back to 2020 when COVID began. And I remember being in the emergency room. I'm still working as a full-time emergency doctor currently in Florida, and looking at my colleagues, right? And thinking about, who is taking care of us? Who is taking care of those who are giving care at the bedside? Who is seeing more death than most of us have ever experienced in our lives and feeling completely hopeless, not hopeless. I misspoke. Helpless is the word, right? You're seeing these patients coming in and they're hypoxic, their saturations are 30%, stuff that none of us had really ever seen before in our lifetimes. And, some of the most trying situations that I've had as a ER doctor was being the last person that this patient spoke to before I intubated them and learning that they did not make it out of the hospital. And, during those time periods, there's no time to debrief or, really decompress, because the emergency room is full of patients and you have to go to the next one and the next one and the next one. And so in addition to that, around that time period, I also learned of the death of one of my mentors from my residency program. I trained in New York Presbyterian emergency medicine residency, and one of the attendings that taught me and molded me into the doctor I am today, Dr. Lorna Breen, died by suicide. And it was the culmination of all of those things that really ignited the desire in me to try to do something, to try to do my part to make things better for us as healthcare professionals. And as an ER doctor, I knew very well that just focusing on me as a doctor and my needs wouldn't get me very far in a shift in the emergency room, because there's more people involved in taking care of this patient in front of me than just me, the doc, right? If it was just me, nothing would ever happen. I need nurses, I need ancillary staff. And so when I created Hope for Med, it really was through the lens of an emergency room doctor and a focus on the team. The team needs to be well for us to be able to effectively take care of our patients. So with that in mind, I thought, okay, what's the quickest way for me to be able to connect with my colleagues and fellow healthcare professionals and really just kind of focus on the whole concept that you're not alone, that we're all in this together. So many of us walk around in our silos. We walk around with these masks and we're not really vulnerable with one another. There's no time really in the middle of the working day to even be able to connect like that because we're so busy. And so, I thought, what better way to be able to create um, this resource than through podcasts. And that was the quickest way that I would be able to do it. So I launched my podcast called Hope for Med Podcast. And on that podcast, I feature stories of healthcare professionals. And it really is just conversations with them, about their why, about the good and bad that they've experienced throughout their careers. Have they experienced burnout and what they did to try to combat the burnout, and if they're still working at the bedside or not, and just kind of those types of stories. And of course we talked about, mental health and wellness amongst healthcare professionals. And I realized in hosting these podcasts that there was this broad continuum in terms of comfort levels of healthcare professionals talking about, certain topics. And so I made it so that the featured guests had options. They had options to be anonymous or not. And that concept of anonymity was very, very important to me because I just really wanted them to have an opportunity to share their story. And I didn't really care, if people knew the name behind that story. If they weren't comfortable sharing the name behind that story, it's perfectly fine because you get so much benefit from just releasing it and talking and letting it out. So when I started thinking about, I want to do a little bit more than, just the podcast. I want to create more resources. Then, the anonymity piece carried along with it. And I was like, so what could I go to where there would be an opportunity for people to be anonymous if they so choose, right? If they so chose. And that was really important because, I always thought it's important for us to be able to decide, right? So many of us, feel like, we are just, our ability to think for ourselves is being taken away, in our day to day. And I really wanted to give that back to healthcare professionals. And so when I was thinking about what resources were available that would allow us to really have somewhat immersive experiences, but still allow for anonymity, that's when I came across the metaverse. And I thought it was absolutely perfect because in the metaverse, you engage with each other as an avatar. And, in this 3D version of yourself, you can get up, using your keyboard and your mouse, and you can walk into different um, rooms, auditoriums. You can have hallway conversations with people. And it's just a lot more immersive than what is currently available. In addition to that, you could dress your avatar however you wanted your avatar to be and look, and you can name your avatar whatever you wanted. So it kind of continued along the path of the podcast where I can name my avatar Lotion, right? But behind Lotion is me, Dr. JB, and I'm connecting with you, you know, sneakers, you know what I mean? But Lotion and sneakers are both physicians, right? And we're connecting and sharing. And, I could decide to continue calling myself Lotion, or I could decide to call myself Dr. JB, but it doesn't really matter. But it's still an opportunity for us to connect with people, not only, my hospital, but throughout the entire world, as long as you have a computer, a keyboard, and a mouse, right? I went with a platform where you didn't need to have the Oculus because that's cost prohibitive. But as long as you had a computer, a keyboard, and a mouse, you could engage.
Yeah, and it adds that extra layer, uh, especially for healthcare professionals where you can connect. But then if you are traced back, on anonymity, a lot of times is very helpful, especially to be vulnerable, because in many states, I think where we up to 16 or 17 now that don't necessarily have those questions for um, license renewal, but it's a big deal to maybe even show that you have an issue or a concern of mental health or burnout, especially as a physician.
Yeah, because we're supposed to have all the answers, right? And we're
Right.
not supposed to make any mistakes because, of course, we're perfect.
Right.
And that's definitely something that I'm, fighting against because we're not perfect and we are human beings. And as human beings, we will make mistakes. We'll have good days, we'll have bad days. And just because we, made a mistake the mistake doesn't define who we are. And too often you find healthcare professionals really focus on, is if they got a 95%, right, on their exam or whatever it was. Oh, but what about that 5%? They don't care about the 95%. What about the 5%? Similar. They did everything well and did one mistake, and they focus on that one mistake and kind of disregard everything else. And that's what my mission with Hope for Med is, really kind of to change that mentality amongst us as healthcare professionals.
Thank you for sharing that. And I think that this work is very important, especially with, I had no idea that you were that closely connected with Dr. Breen, and I'm really sorry for your loss.
Thank you.
Unfortunately, it seems that it has to take a catastrophic event with either a physician suicide or a pandemic to unmask these things that show us our vulnerability and our humanity.
Mhm. Yeah.
So, how did you deal with the grief of losing a mentor to death from suicide?
Mm. It was definitely hard because that happened in the midst of COVID. And so there were a lot of other things happening at the same time. I think my way of really dealing with the grief was, well, allowing myself to grieve. I gave myself permission to cry and remember. And then I made it my mission to really grow Hope for Men, right? I remember in the early stages of making it, I thought, if the work that I do through Hope for Med, touching one person is enough. And that really has been my guiding light. If one person finds value in what they hear or in an event that they attend, if one person felt isolated and heard a podcast or attended one of these events and realized they weren't alone, that they weren't the only person, then that was plenty. So I think me focusing on really doing my best to make healthcare professionals aware that this resource was available for them, and this resource is not affiliated with your place of employment, which I think is extremely important. I really, worked hard to really separate Hope for Med from healthcare systems and whatnot, because I really want it to be a safe haven for us. Then, in many ways, that's my way of honoring Dr. Breen and really doing my best to make it so less and less people have to experience the death of somebody they care about.
That's a beautiful mission. And that's a great way to honor Dr. Breen.
Thank you.
What you say hits home. What you say hits home with me. And I love the fact that you're opening it up. Like you said, we work as a team in healthcare. Healthcare really is a team sport. And so you're opening it up not just to physicians, but all healthcare workers, because it's an isolating profession. It can be because of the trauma we see. You see much more than I do
Mhm.
as an ER physician. And especially during a time in modern history when there really were no resources. How do you process all the losses that you have seen coming in and out, in and out, and it's going to be the repeat the next day?
Mhm. Yeah, and you didn't want to bring this home to your loved ones.
No,
You didn't want them to experience vicarious trauma from the words that you're saying about your day. Um, and sometimes just people outside of the healthcare system don't really understand. Um, like, why would a doctor struggle, right? Like, you have so much money and, and whatever they say. And it kind of just like makes it so that you can't open up when you are encountered with that kind of mentality. And that's why the peer support portion of this is so important, because as a peer, we understand, we get it, but others that may not be in this profession may not.
One thing I try to inform patients and even non-medical individuals is that it does not matter how much money anybody has. That does not protect you from mental illness. There are several famous people that have much more money than physicians that have also died by accidental overdose or from suicide. So
Sure.
just to make that a point, and while we as physicians do have a comfortable lifestyle, it also comes with a lot of times hundreds of thousands of dollars of debt and
Exactly.
10 years of not earning. So we start behind the eight ball.
Mhm. Yeah, but how many physicians and other healthcare professionals have you encountered who, that is the response, right? From their family members and other people, but you're a doctor, and it's like, yeah,
Yeah.
I'm a doctor, but, I'm a human being that's, um, every day in my job, I'm faced with so much heartache and trauma and what am I supposed to do with this? And I can't necessarily talk to you because this is your response to me. Like, oh,
Yeah, no, absolutely. I agree. And one thing I say is I'm not a superhero, right? I'm not a superhero. And I think many that go into the healthcare profession, many are empaths.
mhm,
Yeah. But also putting that aside, you see, and I, in my exam room, I hear things that I wish I didn't because of the trauma,
mhm,
because of the things that I can't imagine. And again, how we still have to process that. And if we don't let it out, it manifests as other ailments.
mhm,
One thing that I can appreciate about the medical field is that it definitely creates a bond that goes beyond geographical location or time and space. Is that if you know, you know. And I think another area that is very similar with bonds, and if you're not in it, you don't know, is the military. Very similar training and the experiences and you rely on one another. But going back to the relationship of having that bond and the relationship that you are creating with Hope for Med, and then adding another layer of anonymity in the metaverse, that's ingenious.
mhm. Yeah, thank you. Going back to the example that you just mentioned, I think, where medicine and the military end up differing is when we take off our mask and talk like we're having a conversation, then yes, we realize that we're on the same team. But sometimes, and maybe I get it more because I'm in the emergency room, like when as an ER doctor and I'm talking to other colleagues, it doesn't feel like a team sport many times. Um, you know, there's a lot um, of course, healthcare is hierarchical, um, and but it's different specialists, right? They talk down to you, um, they try to degrade you. You know what I mean? Like, um, and it's not very supportive. And even the training isn't supportive. I don't know what your experience was, but going through it, it wasn't a lot of like hugs and kisses, when I was going through medical school residency. It wasn't like that at all. And I don't think that it needs to be the way that it currently is. I don't think that defines you and turns you into an amazing doctor. What that ends up doing is making many people be like, well, I went through this, and so you can go through this too. And it just continues that cycle. And I don't know what your experiences were yourself.
I trained here in Kansas. I trained in Wichita as far as my residency and the second part of my medical school. And for the most part, it was the typical Midwest, pretty welcoming actually. There were a couple of bumps in the roads, but we had I did have attendings that were very protective, and I still keep in touch with them to this day actually. And here, when I practice in a small town, I would say that the specialists and the ER physicians and primary care docs, I think we have a good working relationship. I'm glad you brought that up, though. Almost perpetuating generational trauma within uh, medical students and residents and the trainees, and we've really got to break that cycle to make it better for the next generation of physicians.
Oh yeah, 100%. I mean, I think you're very fortunate that you trained in that setting. I think you'll find that a lot of other healthcare professionals may not have been as fortunate as you. Um, and I trained at in like some bigger cities, big hospitals, and um powerhouse academic institutions, and it's competitive, right? Um, and I've encountered that. I've seen it. Um, and of course, yeah, I made it through, right? Like I'm a practicing doc and whatnot, but I don't think that, you have to jump through all these hoops to really make it to the end. And you find when you look at mental health and wellness amongst healthcare professionals and say medical students in general, there are statistics I came across recently where medical students are 15 to 30% more depressed than the general uh, public. And then, when you look at suicides amongst healthcare professionals, it starts early. You see it happening in medical school. You see it happening in residency where I trained. And I know 2 residents died by suicide during the period that I was at my residency program and then beyond. Um, and things definitely need to change, right? And so, when with the creation of Hope for Med, what I tell people is my vision for this company is for it to be the supportive arm of the healthcare system throughout the US and the entire world. Because that's something that we don't have right now. Um, but we need.
Yeah, absolutely. Absolutely. Compassion is free. Kindness is free.
Huh?
We can, if we cannot show each other compassion, I doubt that we can show ourselves compassion or even our patients. And it really translates at the bedside too, which is very disheartening. So I absolutely love Hope for Men, and it says it in the name, and what you're describing, it describes it beautifully. So is Hope for Med only for those in your area, or is it also open to, for example, I'm in Kansas. Would I be able to engage?
Oh, yes. It is open to anyone, anywhere in the world who has access to a computer, a keyboard, and a mouse. It's really all you need. And right now, can speak English. In the future, once we're able to translate in real time, then it'll be a lot more accessible. But yeah, no, it's not. I think, the only limitations that we put on Hope for Med is that it's open to people in the beginning of their training. And so once you start medical school or nursing school or pharmacy school or whatnot and beyond, the goal is to really help people get their license and keep their licenses for as long as possible, by really providing them that support that they need to really get through the day and face another day. But not in the realm of I have to go again, but with cups that overfloweth to really help you strengthen that empathy and that compassion, but compassion for self first, right? You first have to take care of you, right? You need to be well. You need to be whole to be able to take care of others. And that's really our emphasis is where can you go to really connect with your peers and really obtain the resources that you need to optimize your wellness and optimize your holistic wellness. And so we focus on numerous dimensions of wellness, not just mental wellness, financial wellness and social wellness and physical wellness, like 9 dimensions of wellness to really make you holistically well.
I love it. And the fact that you're getting them early in their career is so, so important. This would be a really, really good tool to prevent burnout. And what is a website? What is a website for Hope for Med?
Hopeformed.com. So HOPE, the number 4, MED.com.
So to all those listeners out there, I would encourage you to type that in and reach out, because this is a beautiful resource. And even if you think that you're not going to need it, I guarantee you will, because medical school, nursing school, pharmacy school is no joke. No matter how smart you are, it is always, always good to establish that connection with peers, because it is so important. A lot of people, like we were discussing before, outside of medicine, it is very difficult to discuss these things without having somebody have a preconceived notion. But also, we're social creatures. So take advantage of this. And Dr. JB, which platform do you use in the metaverse?
Verbella. It's spelled V as in Victor, I, R as in Rachel, B as in boy, E as in egg, L as in Larry, A as in apple. Verbella.com. It is a web-based platform that you would download onto your computer. So you kind of have to have some space on your computer to download it. When we have our activities in the metaverse, because we've come across some people who are not able to download it onto their computers. And so we host hybrid virtual events. So we will do like a Zoom component and allow people who can't download it on their computers to be able to still participate and engage via Zoom. Granted, it's not as engaging of an experience because you are not your own avatar. You're experiencing and engaging with others through the eyes of an avatar that's on the platform. But that's always an option for those who cannot download that app onto their computers or laptops.
So it's pretty inclusive, that you look at how to bridge the gaps for those that might not have complete access. So thank you very much for sharing your story. And for me, it's quite moving. It's actually very moving. What's one last pearl of wisdom you would like to leave our listeners?
Really, it's just that self-care is not selfish. I think, as empaths, we think about others before we think about ourselves. But that is the quickest way to burn out. That's the quickest way for us to stop work in a field that we dedicated so much of our lives to entering. And, really creating a paradigm shift where, our wellness as healthcare professionals becomes core and central is really important for us to really, optimize the care we give to others. And so really, prioritizing self-care, scheduling in some self-care activities is important in optimizing your overall well-being.
Thank you for that. And the URL for Hope for Med will be in these show notes. And on what social media platforms could our listeners find you?
So I am primarily on LinkedIn. So that is my spot. So on LinkedIn, you can look me up by my name, Dr. Naomi Jean Baptiste, or the Metaverse Doc. I go on LinkedIn by that. I'm on all the social media platforms. So you can find me on Facebook and Instagram, but LinkedIn is really where I focus most of my attention.
Thank you for that. And those will be in the show notes too. Well, Dr. JB, thank you so much for your time. And again, I really, really appreciate everything you're doing for the medical community. So thank you.
Thank you. Thank you so much for having me. This was absolutely an amazing conversation, and I really am honored to be here with you.
If you have enjoyed this episode, click subscribe, share it with a friend, because we could all use a little bit of normalizing the topic of burnout, knowing that we're not alone.